to the office. Thank you for coming in today. It's nice to see you. I am going to go ahead and get started with your chiropractic assessment. There's quite a few things that I would like to go over with you. I was reading a little bit in your notes and what you filled out in your profile online. So it looks like you've been having some neck and shoulder pain, a little bit of back pain, seemingly related to your work from home status. So you spend a lot of time sitting in a chair, which is understandable. So we'll be having a look at all of that today. I want to do a bit of an assessment of your posture as well as go over a couple treatments that I think might help you out, okay? So is it okay if I get started by just putting your hair up just to get it out of the way? Perfect. I just have a hair tie that I'll be using to tie your hair up, and I don't want you to be alarmed. It is brand new. You're welcome to take it home with you. So I'm just going to place your hair in a low bun. Is that okay? Making sure to gather all of your hair. And just going to place it in a bun. You let me know if this is too tight. Cute. Does that feel okay? Yep. Okay, perfect. So let's start by having a look here. So I'm going to have you just sit up fairly straight, tall shoulders, and kind of relaxed here just so I can get an idea of how well your posture is, see if there's anything specific that we should be addressing today. So immediately I am noticing just a little bit of tension kind of laterally here to the neck. Is this about where you feel some of that discomfort?
Yes.
Okay. So definitely I'm feeling some tightness here. Not as much on this side. Okay. Having a look at your back as a whole and kind of seeing where your spine falls in comparison to your rib cage and your lower back. Checking for symmetry and just looking to see if I notice anything acutely abnormal, which I'm not seeing right off the bat. Spine does appear midline. Scapula is bilaterally placed. It does appear that your left shoulder is slightly higher than your right. So it does look like you have a little bit of a misalignment here. So you're kind of leaning this way. And you are right-handed, correct?
Yes.
Okay. Definitely feeling some tension in that area. Give me just 1 second. I just want to mark that down. Okay. So left side. Slightly off center. Okay. Are you in any pain at the moment, Isabel?
No.
Okay. Very good. Okay, so let's go ahead and move on to testing just a little bit of flexibility. And this is essentially going to allow me to see how severe this is here, okay? So what I would like to do to start is have a look at the unaffected side. So what I'm going to do is have you bring your elbow back, just like that. And extend up as far as you can. So is that as far as you can go here? Perfect. So I'll have you hold like that for just a second. So I'm just going to use the middle finger as a guide. And okay, so we're about normal extension there. Okay, so that's pretty good. Good. Okay, so I'll have you now do that with the other arm. So just gently extend. Okay, so so immediately we're hearing some kind of forceful tension there. I did hear a pop in your shoulder, which lets me know that you are struggling a little bit more on this side. And it's not a severe difference, but I do see that you're not quite able to extend as far on this side. So specifically your elbow is not as close to your body. We're getting a little bit more of a 45-degree angle here. So you can go ahead and relax for me. Is your shoulder feeling okay? Mm-hmm. Okay, good. All right. Okay, so I did hear a little bit of a pop there. Any pain or pressure here? Not so much? Okay. How about on the side of your neck here? Not so much. Okay, good. So I'm not noting too much tension here, which is a good sign. So I'm going to have you turn your head all the way to the left for me. Good. And all the way to the right. Perfect. Okay, so just slightly off there. Not too bad. Okay. So I'm going to place pressure on your spine as I pull your shoulder back. Good. Okay. All right, go ahead and relax. I'm going to do the same thing with the other side. Okay. So again, a little bit of a difference there. Your left side is visibly higher in ratio to your right. So you do seem to be kind of leaning completely over to the right side there. Okay, so I'm going to bring out a tool here. And what I'd like you to do is bring that left arm back for me one more time. I'm going to have you hold on to this with this arm. So grab tight. Good. And just keep holding on to that, okay? So there's a decent amount of flexibility here. We were able to achieve that 90-degree angle. Is that painful at all? Mm-hmm. Okay. You should feel a little bit of stretch in your arm here. So it's very good. Perfect. Okay. So what I'm going to do is have you grab the other end of this with your right hand. And this is an exercise that I want you to perform at home. So what you're going to do is start with it kind of where it feels naturally comfortable to you, and then you'll gradually pull with your right hand, and that's going to help you achieve that angle here. So what we're looking for is your left shoulder to be at a 90-degree angle all the way down. You should have a small space here on your elbow, and the way you can gauge that is by doing it the other side first, because your other side is already in the correct place, okay? So this will allow you to kind of naturally realign that side. So that is perfect. I will go ahead and send you home with this tool, so you can relax for now. Okay. Okay, so just gonna have a bit of a look here. I think I'm actually, is it okay with you if I just undo your shirt here? Okay. This for now, just so I can have a little bit of a better look here. And having a look at the natural indents of your back. Again, they are slightly off center. Okay. Maybe take a deep breath in for me. Go ahead and release. Do that again. Release. One more time. Perfect. Okay. Very good. Okay. So So now what I'm going to do is a test for temperature variation. So I'm going to be placing the backs of my hands along your back, and I'm just feeling for any areas that might be warmer than others, okay? So this is just going to allow me to test for any places that might have excess inflammation. So typically we would see that in the affected areas, but it's good to test everywhere to make sure we're not missing any affected areas. So comparatively, your left side is slightly warmer. I'm feeling a little bit of a difference here. Nothing that I would say is too severe, but it does appear that there is a little bit of inflammation on the left side. Okay, so now that I have a good idea at what exactly is going on, I'm going to go ahead and have you lay down. So let me just adjust the table slightly. I'll have you lay on your stomach to start, okay? You're welcome to take your glasses off. I am going to have you place your face in the little space that's there, and then we'll kind of get you comfortable, okay? Okay, perfect. All right, Isabel, thank you so much for getting into position. Are you comfortable? Perfect. So we are going to go ahead and get started with the physical portion of your examination. I'm going to start by just kind of maneuvering things back here a little bit, having a look at that shoulder and kind of moving down. So basically how the body works is we might feel tension in certain areas, but everything is connected. So the tension that you're feeling in your neck and shoulder are likely related to poor posture in your back, spine, and gluteus, as well as your feet. So having a little bit of a look at everything and just kind of assessing you as a whole, okay? All right. So to get started, I am going to apply a little bit of coconut oil, and this is just going to allow me to have a little bit of a slip of the skin so that I'm not causing any tension or pulling at your skin at all, okay? Just a little bit cold. I do apologize. I will warm it up in my hands for you, but I do want to just give you a warning. Just kind of in a general area, and then we can reapply as needed. Just enough to allow my tools to gently slide across the skin without any excess tension, essentially. Focusing majority of the application on the affected area. I'm going to go ahead and move into a little bit of a light massage of the area, and this is just going to allow me to kind of introduce my hands to the muscle as well as loosen up some of the tension here, and that way we're not causing you any pain when we get started with the Gua Sha. So just using my thumb as well as the pads of my fingers to very gently work on the area. Now, if at any point this causes you any pain, please let me know. Just working that in, allowing the muscle to warm up slightly before moving on. pressure to kind of feel along for any excess tension, any areas that feel out of place. Alright, so let's go ahead and move on. I do have a tool here that is called a reflex hammer. For the purpose of today's visit, I will be using it just to kind of work in smaller areas here. So it does have a bit of a pointed tip, and it's just going to allow me to get into these circular areas that are a little bit hard to reach with my hand. So applying a firm, steady pressure. I'm looking to see a certain amount of discoloration on the skin. Indicates that the right amount of pressure is being applied. And because this is an introductory visit for you today, I will not be performing any adjustments. These micro adjustments will just kind of very gently alleviate the tension, and then on your next visit, which we'll discuss a little bit later on, we will work on doing some actual adjustments where we kind of initiate some cracking and that kind of thing, your more regular chiropractic assessment, okay? So for today, I'm just getting an idea of what your needs are going to be moving forward. Very good. So using the other side of my hammer to do the same thing on the lower region of your back. Different tool here, and this tool is made out of wood. Again, this is just going to allow me to get into those tighter areas of the neck. So I'm going to just pull your skin slightly taut and just moving in small linear motions all the way down the length of the back along the affected area, and I'm going to follow this down on top of your clothes. So as I stated, the muscles along your gluteus are all connected to your spine as well as connected to your neck, and poor posture can affect more than one area of the body. Very good. Okay. Already seeing that beautiful discoloration up here, that lets me know we are relieving the necessary tension. Are you feeling okay so far? Okay, good. Doing very well. We are going to keep moving right along. And the next tool I have is made of stainless steel, and it's just going to allow me to apply a very gentle acupressure to these areas. So essentially what I'm doing is guiding that excess fluid and the excess tension in your neck down towards your feet. So just encouraging lymphatic drainage, and at the end of our session I will be applying a cupping mechanism to your feet. and that is what will further alleviate that tension. So everything kind of works as a system. Essentially at this point, I'm just allowing things to flow naturally downwards. You are doing so well. And using the other side of this tool to move in a circular motion. Again, following those meridians down the gluteus, across the lower back, and along the muscle that runs on your thigh. Gentle but firm pressure as we go down. Perfect. Alright, so the last thing I'm going to do before we move on is just a little bit of Gua Sha. So I have a tool here that will allow me to kind of navigate these more concave areas. So what I'm going to do is first apply upward pressure and then swift, smooth motions down and out, which will begin that lymphatic drainage. So down and out, away from the affected area. And I am applying a very firm pressure. A firm enough pressure to allow the angles of my tool to manipulate the skin just enough. And again, down and out, all the way down. Doing great. Did hear a little bit of a slight cracking there, so those micro adjustments are working their magic. And swifter movements as we move down towards the lower back. You're doing great. Again, working into the muscular area of the lower back. Following down the muscle that runs into your thigh. Very good. So I'm going to flip my tool over. Use the shorter side. Great. Beautiful. Okay. Alright, Isabel, so we are going to go ahead and move on to the final part of your session today. And for that, I am going to slightly adjust. I will raise your legs one at a time, have a look at your feet, and apply our cupping therapies, okay? So give me just a second, and I will go ahead and get that started. Alright, Isabel, so as the last part of your session today, I am going to continue with the acupressure. This time just doing a very short session to relieve tension on your feet. So just going to apply a little bit more of that coconut oil here, just enough to kind of lubricate the area as to not cause any friction of the skin. So allow me just a second to rub this in before I get started. Just feeling for any points of tension, usually that lie in the kind of plantar fascia region, but I'm not feeling anything there. So I'm going to go ahead and go in with my tool and just applying that same gentle pressure as before. Good. Making sure to go up and in between the different muscles of the pad of your feet. You are doing great. I'm just going to flex and extend for a second. Very good. So I'm seeing healthy arch here. Does not appear that this area is overly tight. Not seeing any excess tension here related to that pain in your neck, which is a good sign. Okay. Perfect. Okay, so the very last thing I'm going to do is just go ahead and apply a mild cupping device. So wait just a second to get that ready. And of course the reason for this application is to further alleviate any excess tension. So I'm going to apply that here and just going to feel a little bit of pressure. It will not cause you any pain. Perfect. Does that feel okay? Allowing that to alleviate any excess tension. You can already see the discoloration accumulating underneath the cupped area. Again, flexing the foot. Perfect. Let's move that up slightly. Very good. one final time here. Good. So I am seeing some active tension release in this area. Perfect. Okay. Okay. So all done with this foot. I'm just going to go ahead and massage out that area. So just kind of gently release the excess buildup there. Alright, allow me just a second to move this out of the way. And I am going to go ahead and switch here so you can just relax the leg. Perfect. And again, just performing a bit of a visual assessment on this side. As stated, this leg as well as this side of your body as a whole was not as greatly affected as the other side. But just as a measure of thoroughness, I will go ahead and perform the same therapies here. So again, just applying our oil. This will ensure proper lubrication of the area as to not cause any tension to the skin. So, looking for any possible areas of excess tension, mainly along the plantar fascia. Again, not feeling anything here. Okay. So, just going to gently flex the foot as I apply pressure with my tool. Following along that center meridian of your foot. I'm going to go ahead and move along with our cupping treatment. Very good. So I'm seeing a little bit of that discoloration build up, which is a good sign. On to our second area. Again, notable tension built up here, which will be released as we release pressure from our cup. Very good reaction there. And we'll do that one more time. Doing very well. We're almost done. Just using my Gua Sha tool to smooth out the affected areas and ensure return of blood flow to the pads of your feet, as well as encouraging lymphatic drainage. And relax your foot. Alright, Isabel, you did very well today. I'm glad we were able to provide you with a sense of relief from your neck and shoulder pain, as well as from any stagnant buildup in the soles of your feet. So I would like to see you back for another visit here in about 14 days. That'll give your body a chance to recuperate some of the affected areas that we've treated today, and we'll kind of reassess and see what your needs are at that time, okay? Okay. So I'm going to give you a couple minutes to relax. You still do have your 15-minute session where you can just remain in the room, relax as needed. You're welcome to wash up in the bath. You can get ready at that point and go ahead and come out to the reception desk to schedule your appointment, okay? Perfect. All right, well, have a good evening. Thank you for coming in.